Welcome back, everyone. Episode 19. This is an exciting start to our Bulletproof series. What me and Dr. Jace are going to talk about is bulletproofing the athlete. We're going to take certain athletes. We're going to start today with the golfer. Coming up in the series, we might touch on different types of athletes and just how to bulletproof their body, what they can do to make sure to prevent injury, and actually, even from the mental aspect too, really the things that they need to focus on moving forward if you're going to be a professional athlete or even an athlete that's going to be competing at a higher level. So today is our part one, bulletproofing the golfer. We're going to really touch on a lot of things today. We're going to touch first on the common injuries that golfers usually sustain. We're going to be talking, really breaking down the psychology aspect, the mental health portion of golf and why it's so crucial to make sure that you are touching on that as a professional golf athlete. We're going to dive into sports therapy and how a lot of golfers are starting to use that. We're going to dive into 3 very famous golfers' workout routines, and really Dr. Jace is going to do a great job of picking apart what they're doing right, maybe things that they can work on. And then finally, we're going to end with a really large study just showing how this one author's aspect of preventing injury, what the good parts of the research are, what maybe things that we can add in as far as our expertise. And yeah, it's going to be a fun one today. I am Dr. Addy.
And I'm Dr. Jace. And yeah, we wanted to make this podcast and this series something that any layman person going into any of the sports, so today is going to be golf, will pick up some of the basics and some of the stuff that they can work on and train towards. And then we're going to dive into some other specifics that high-end athletes have to pay attention to as they go through not only bulletproofing their body, but also their minds, which for golf is incredibly important as we go through here. So I think it's best to start off with, in order to bulletproof the body, we want to have a general understanding of any past injuries that one has gone through, because that can create compensatory or compensations throughout the body, which for golf will alter swing mechanics. Yep. So we want to start with the injuries first. Now, Doc, for the common injuries of a golfer, especially the stress that it can create during the swing with whatever club they choose and decide, what are some of the common injuries that golfers may see?
So to start out, if you're already a golfer, I'm sure you know this, but if you don't, lower back is an area that gets so much strain and stress put on it when you're golfing. Of course, when you think about a golf swing, you have the fast rotation, which again is put right through the hips and the lumbar spine. So right away, number one, lower back injuries are very common. When you have the repetitive twisting motion, as chiropractors we know, puts a lot of stress on the disc. And if you don't have the proper stability around that spinal column, it's just going to put more force into those delicate structures that can become injured. And so you want to make sure that you do your best to not only continue to strengthen around the spinal column, but even throughout the hips, which should be used more in a golf swing. And a lot of people that have stiffer hips or even arthritis in their hips, or as they get older, they lose that ability. And I think that's where those injuries can start to happen. So you have, poor swing mechanics, overuse, those kinds of things that can cause low back pain. Number 2 would be elbow injuries that, again, fast torquing coming in that downswing on the arm can cause a lot of epicondylitis, a lot of strain, especially if you don't have a fluent swing or if you're just starting out. There is often a lot of micro tearing of the tendons, either on the inside or the outside of the elbow, just again due to that repetitive stress. And usually one of the most common issues with elbow pain is that you're gripping too hard. And a lot of the times, if you're going to do golf or even take golf lessons, the first thing you learn is grip. Because if you have what's called a strong grip or a neutral or a light grip, depending on how you grip it, is going to impact your longevity of the sport. So that's the first thing that they usually teach you. Next is usually shoulder injuries. Again, you have a lot of upper body motion throughout that swing. With the changing of how you hit your shot, whether it's a cut or a draw, again, those are just different angles of how the ball flight goes. So if you golf right-handed, technically one of the most common shots is starting out as a slice. So you hit the ball and it kind of goes away from you to off to the side. And usually that's done by not swinging in more of a kind of a arcing C fashion. It's more of a over the top or underneath fashion where you can get a different change in the angle of the ball path. So that actually can be done in a way that doesn't cause issues, but learning just how to do that, usually golfers will over exaggerate how they come down on the ball, and that can actually put a lot of strain and stress on that scapula and that shoulder. And then lastly, knee injuries. When you are swinging through the hips, you have to put a lot of strain on usually your lead knee, which again over time can cause meniscal tearing if you put too much force or an improper amount of force distribution on that knee. Patellar injuries, ligament injuries. Again, this twisting and pivoting motion is what's going to continue to put a lot of stress on the knee. So just making sure that you have the proper flexibility before you even start to put a lot of swings in. It's going to already, impact that long term. And again, just understanding recovery and overuse before those injuries start to get to you, of course. So, Doc, let's take apart those just one by one, just very quickly. And just, I'm curious on where you would see someone having an injury due to either a compensatory overuse pattern. So low back, I think that one's going to be pretty standard. And when we see that over rotation and overuse, where do you think the weaknesses are, and why would there be an injury in that area?
Depends on where they're at in their life. So like a 60-year-old who's gone through life, who has spinal back surgeries, there's limitations that what they have versus someone that is starting off with or earlier in their age on 20s, 30s to a certain extent. But let's say they had an injury, whether it's let's say a disc herniation, to where the disc in between the bones and the lower back is impinging on the nerves, and then there's a lot of muscle guarding, even if it's an old injury. So looking back to some of our past series on the body series, the region series of the lower back, on how certain people, especially if you've had herniated discs and a medical practitioner goes in and gives a steroid shot, we know now that will freeze that disc up to hold it outside of where it should be, to put constant pressure on the disc. So before, let's say you want to go into a more competitive time of your life for just attacking golf, beautiful. Ideally recommended to have a medical practitioner do a whole workup of your body to see where those specific injuries are, if there are any, but usually they'll come in terms of muscle guarding tightness, a lack of brain to body connection, and everything will stiffen up from there, which will then lack the rotation, especially bringing everything back up overhead, and it'll force more compensations to the shoulders or elbows or even knees. Because usually if an area is not working properly, if you don't have the mobility, it's going to compensate above and below the area. So that can be the same true with the lower back. It can be the same thing, and it's very true with the knees, the shoulders, wrists, elbows, like the whole gamut. So I think first things first, assessment. What's wrong? Where are areas that you need to improve mobility? And then go into proper mechanics and build up from there. Let's say you're listening to this, you golf on a weekly basis, or you're competitive. If you don't have a body coach, it's going to be one of those where you got to figure this stuff out yourself, or you're just building your swing on a compensation, which over time naturally will give out. Thus, we're going to touch on Tiger Woods here in a second. We all know how many injuries he has had.
No kidding. Laundry list.
So I think a lot of this will come down to whether it's any part of the body that we just touched on, to making sure that everything's moving properly. If there is any areas of pain, especially in the past, that you still want to go back through, because pain is the last thing to present itself. First thing we're able to get under control, but unless you adapt the tissues with the whole overall body mechanics, it's going to be an uphill battle regardless.
Good example, actually, is a patient we have. He's a golfer, and how, Doc, you want to just touch on, he's got terrible scapular winging, and it has played a horrible impact on his shoulders and his back. So just even something like that, how would that weakness create such change to the body?
Yeah, so like let's say, and that presented itself with the clavicles being anatomically short, which is forcing compensation to the shoulder blades. So for that specific person, we want to decrease the tightness on the front side, especially pec minor, and then also break apart the tension from the humerus upper arm to the scapula, especially the teres major minor complex and lats. Once we isolate and break apart the compensations on the front side, it then allows for proper motion of the scapula to work in unison with the upper arm. Now, he's seen huge improvements to where he's hitting the ball longer, straighter. He decreased weight of his clubs, which will naturally have better control of the club head going through the full range of motion. So again, tackling the compensations, and then Doc did an awesome job working with certain swim mechanics on warm-ups to help transition weight to combine the lack of compensations to a better performing swing for his body.
Yeah.
So Doc, please.
Yeah, absolutely. So with that too, a lot of that, which was already tough because he had these weaknesses in his shoulder. So we wanted to try to take that force away from his upper body swinging, and he unfortunately was not swinging through his hips. So a lot of the rotation came from his upper body, not the lower body. So already we had an issue of compensatory strain on the upper body. He was really trying to come through with the shoulders, which again, he already had such a poor weakness in that area. So there was bound to be issues if he wasn't going to get that addressed. And again, this all came from, like Doc said, a proper assessment, knowing where your weaknesses are, and you got to hit to make sure that if you aren't addressing that, it's going to only cause issues long term. And we'll actually jump into how one golfer really broke down his weaknesses and pushed through to gain so much yardage off the tee, which is Bryson DeChambeau, and I think that's going to be a fun one to jump into too. But yeah, like Doc was saying, he had a lot of things going on. He had weaknesses in his shoulder. He was using way too much of his upper body to go through his downswing. So again, we broke that apart, helped to create any change in tissue balances with the shoulder. I made sure that he started practicing using his hips as his rotation pivot, not his kind of upper body, which again, we want to avoid as much rotation as possible in the upper body, because again, it's only going to cause strain in that low back and again in the shoulders. So yeah, what we're talking about is really what a lot of these golfers have probably struggled with early on, and you will struggle with early on if you don't get a proper assessment to begin with. And you know, as a professional golfer, they have done tens of hundreds of thousands of swings. So if you already are starting off on the wrong foot, 10,000 swings forward, it's going to be a nightmare for you. And that's where, if you wanted to start taking up golf, it's better to probably, in our opinion, to get on the right foot first before you go down a path of just pain and soreness and stiffness. It's only gonna benefit you, I think.
Yeah.
So.
And then as we go through, like let's say you're someone out of state, outside Arizona, outside Mesa, and you're looking for someone to help you through this journey. You're trying to find a medical provider. Ideally, you want multiple sets of swings with different clubs, so you can bring that to the forefront to whoever you see. Ideally, you want to search for someone who has time. So a physical therapist will work probably a little bit better than a chiropractor, but just so they can break down the swing, and then they can combine that with any of the other problems that are going on. And there's usually almost always a correlation between those two, but just something that you can prep going into that session just to find someone and then work with them, ideally year-round on a consistent basis.
For sure. And another resource is the TPI, which is the Titleist Performance Institute. A lot of chiros become certified in that, and it's a great training course. Those guys are experts when it comes to biomechanics of the swing. And again, it's just a great synergistic blend of how much chiros have a background in biomechanics, and then of course just using that knowledge and putting it through the knowledge of breaking down someone's golf swing too. I've used a TPI doc for myself, and it only took a couple of sessions before it even helped, just that alone. And so it doesn't, not to say you don't need more, but for myself, it wasn't too long that I already gained benefit from doing something like that too. So.
Ah, that's awesome.
So we'll get back to, I think, the biomechanics anatomy, but we're going to jump right into the next portion, which is the mental component of golf. And if you already have been following the golf headlines, Grayson Murray was a 30-year-old PGA Tour golfer who took his life, I believe it was last week, and he had withdrawn out of the second round of the tournament and took his life, I believe, the night of or the morning after. And again, this just isn't in golf, but I mean, any professional athlete, I'm sure, has gone through tremendous amount of mental strain to get to where they are. And obviously, that you don't even have to have be a professional athlete to have those strains. I mean, us humans every day have that kind of stuff. So you just want to make sure that if you are putting that amount of pressure on yourself to compete at that level, you absolutely need to be making sure you take care of your mental health. And there are plenty of psychologists, therapists that can absolutely help you keep yourself mentally fit in that category. So today we're actually going to talk about a golfer named Wyndham Clark, who, if you were to watch the Netflix documentary Full Swing, what it showed was he had started working with this therapist specific to sports called Sports Therapist, and she really helped him after his mother passed away. His mom, I believe, was kind of the rock in his life and really helped him through a lot of the tougher times. And so when he didn't have that, it became a lot more difficult for him. And so sports therapy is a beautiful way to blend, especially in golf, just the mental component and how much you are thinking on that course. And they say golf is 80%, 90% mental. And if you've golfed, you know that's so much to be true. It seems more complicated, but once you really get the swing down, it's all mental from there, understanding how to get through it. So I believe her name was Julie, and Julie came in with Clark again after he was kind of struggling on and off the course, especially after his mom died. And the way that I think it was explained was she really extended beyond his technical skills. She tried to address pretty much mostly the mental aspects. And some of the ways that she did that was, number one, I think assessment and goal setting. I think they were breaking down just some of the current struggles and challenges that he faced, performance goals, and then again, they would provide goals in the future to what to hit to as far as just data and tracking on are they making a change and what are the things that they need to do to move forward. I know she did psychoeducation with him, which was, in the way that they put it here, principles relevant to golf performance included discussing the impact of stress on performance and importance of mindset, strategies for maintaining mental resilience during competition. So obviously, Doc, we talk about pain education just as much as how important it is, I'm sure, with education on what you're doing. But do you want to just talk on why, even how speaking about pain in the clinic can be just as relevant as speaking about psychoeducation on why patients need to understand long term before they actually get the outcomes that they want.
Absolutely. So when we're talking about pain, it's very similar to a type of more of a negative stress, if we will. The more you talk about it, the more it comes to the forefront of your mind. Thus, it can take over your mindset, which can frustrate you more easily. So if we combined the pain in clinic to golf and the stress that can come, I think of it most commonly when a golfer goes into a round of golf, it's a bad shot.
Yep.
And then how well can they get over that bad shot? I think a good place to start for most people that can't afford a psychologist to go through the round, or if they're not a pro golfer, would be, okay, let's say you hit a bad shot. Okay, that's fine. What can you do from here moving forward? And have fun with it. Like, let's say you hit the ball in the rough or you hit it in the water and then there's a drop. Okay, so think more or less present time and also moving further into the future. How well can you hit this shot and what are the other variables in play? And not just think on, oh, I hit a bad shot. You have to have a very short-term memory and move forward from there and not delay or not rely back on those negative experiences. And this is also where, if you notice that there's a tendency that you hit a bad shot over and over again, maybe go to the driving range and practice specifically that shot and mentally put yourself in that situation, like let's say the pin is off 50 yards off to the right side, do you need to hit a hook, a draw, or just even hit in that direction?
Yeah.
And then practice that multiple times with different clubs. And even then, like, no one's going to be perfect, even the professionals, to where like there's going to be bad shots
Yeah.
made. It's how well can you move forward from that shot and have fun with it and challenge yourself. Like, there's times where when we watch golf on TV, there's golfers shooting between trees, and what's the best shot for them to either salvage that hole or to even come out ahead.
Yep.
And that's where some of the mental mind games come into play in terms of like visualizing the shot
Yep.
and other fun aspects with
Yep.
that. But
I actually like that you brought up kind of the point of ruminating, right? Like you just continually think about it, and it's actually a sign of anxiety, I believe. And there are times where you're in pain and all you're thinking about is the pain, which only is going to increase that negative feedback loop, which is going to make things worse and worse. And I think, of course, when it comes to psychoeducation, it's the same thing. You continually think about that bad shot, you're not going to be thinking about your shots in the future. And if you continue to kind of catastrophize and ruminate on just the negative, you're already going to be set up for failure moving forward. So short-term memory is a beautiful way that you put that.
And let's say that someone's like a professional golfer, and we see this often. We saw it in the Masters, to where if someone's in the lead or someone's even really close to you, those last two holes, if you start thinking about what the other person's going to do, that's already so much stress coming
Yep.
down. If you just focus on bettering yourself and just focus on your shot and try to take away everything else, I think that'll only help moving forward. But
And I think that's what the best professionals do. They really do. I think Scotty Scheffler, he's I think #1 golfer in the world right now, and he was talking about how he really relies on his caddy during those times to get through the craziness of when he is in the lead or when things are maybe going awry, and he's kind of got to jump back into things. He said that the best golf he plays is one where him and his caddy have just good combo throughout the whole round. It's just really, it's how he said that it's more just keeping a steady flow of convo and his mind off of, I mean, the fact that he's at the Masters and he's on, the Super Bowl of golf stage, and if he can at least keep his mind away from what's actually going on, which is kind of funny to think that he wants to not think about golf when he's golfing.
Yes.
If that doesn't tell you how incredibly mental golf is, it just goes to show that you don't have to continually analyze what you're doing at golf, because again, it's probably only making things worse. And another good way is a lot of trainers and golf professionals have stated that never work on your swing on the course. Just play golf, try not to think too much about it, and then that's when you go back to the range, start breaking yourself apart, fixing what you need to fix. But the second you start needing to think, second guess and think, is usually where things go wrong on that course.
so true.
Yep. See, Julie, she also enlisted cognitive techniques like how to positive self-talk scripts. Just again, I'm sure like we had talked about, just ways to continue getting over negative thought patterns, positive talk only, scripting, even saying it again and again, just kind of willing it into yourself. Visualization exercises to enhance performance. I know visualization is something that you talk so much about too.
Yes.
Regulating emotions like mindfulness, deep breathing techniques. We've talked about breathing, I don't know how many times on the podcast.
And let me just throw out 2 cents
Absolutely.
in there. Let's say you're going to a shot. The fastest way to decalm and de-stress your system would be the double inhale, prolonged exhale. And then if, like, let's say we want to visualize the shot, there's a movie that comes to my mind. I can't remember the name of it, but this gentleman, he visualizes where the ball goes. And the more you get familiar with visualization, the more, and also, especially during the range, kind of like what Doc said, and when you're actually practicing the shot, if you actually take meaningful reps, that will only correlate much more during the regular game when you get into a flow state.
Yep.
So if there's a tough shot, or if you notice that a hole is set up differently, practice and start thinking, and a lot of this will come back to the train, like I said, that how you want to hit it, and then going through that mentally. Mental load is half the part, because then You'll have better communication to your body from there, but
Yep.
it's just another rep
Yep.
that you can go through on a course.
And again, it's like Doc was saying, the more that you at least try to put yourself in that state that you did it, it's already getting you to that feeling of either confidently being able to do it or putting yourself into a pattern of thought that I can do it. And so when you consistently put yourself through, okay, I'm going to hit it around that tree this way, okay, this way, this way, this way, you at least have prepared yourself to try. And it might not work, but the more that you can put yourself into a thought of, I'm going to do it this way, again, just hones in on your focus and your ability to actually make that shot what you want. Because I don't know how many times I've had 2 or 3 different shots in my head, and I didn't commit to what that shot was going to look like, and I swung that shot and it went nowhere where I wanted to because I didn't commit and I didn't properly visualize exactly what I wanted to do. And it makes a huge difference when you can, commit confidently to that shot. Again, we talked about goal setting and performance, feedback and reflection. Throughout the session, Julie would provide feedback and guidance on Clark's progress and performance. They would reflect on his experiences in competition, identifying successes and areas for growth, and adjusting their approaches needed to maximize effectiveness. Again, reflection, making sure that you are able to pick out things you need to work on, but not only that, really hone in on the areas that, again, even on the course, you can say, made it into the sand, and man, I don't even know what to do once I'm in that bunker. Knowing that, so that you have the ability to practice it off of the course and other areas like that.
And just to go to that point, during the warm-ups, practice hitting out of the sand, which if you're a layman's golfer, when you hit it out of the sand, you want to hit it about an inch behind the ball. So as you come through, it'll have that loft. Just a fun point on that one. But as you're in that specific shot and then practice that on the course, like I hit an 8 out of a sand and it went like 150 yards. It's crazy. And I've never done that a day in my life.
Yep.
So I think that mental process at the warm-ups will then correlate like we've been saying,
For
back
sure.
into practice from there. So
And
it's crazy.
practice is going to be everything, not only for biomechanics point, but for neuroplasticity, muscle memory. It's not just cliche, like this is everything. Practicing not only the mental portion of things, but as far as your swing goes as well. But I don't know if I touched on just how crucial Julie was for Wyndham, but he did take this and finally gained his first major at the U.S. Open in 2023. And he absolutely stated that it had not been for Julie in sports therapy, he would not have been able to push through and get over that gap of him not having a major yet. So again, this was so fun to watch. If you haven't seen it, go on to Netflix. It's Full Swing Documentary Season 2. And yeah, it's a really cool story.
And I want to add on to the point. So like when they're going to reflection and feedback, not only is just the negative feedback, but also, and I'm sure she did this, I just haven't seen this myself, where the positive shots are the shots that he did really well. So that tells the brain, okay, there are certain things that we did well that we can ingrain those into the brain and go back there and still practice on it, of course, but we always don't want to look at the negative side of the feedback. We want to look at both spectrums.
For sure.
And then let's say we want to ingrain some of that into our mind, especially neuroplasticity. There's studies that have shown that if you go through a bout of yoga nidra or take a small nap, especially no longer than 90 minutes after the bout and round, will help ingrain those shots during restful state.
Yep.
And that's where a lot of the neuroplasticity comes in. Now, if you're a layman's golfer, this might be a little different to you, but even then, like there's still positives that you can take from that. So like let's say you get done with a bout of golf, like 18 holes, go home, maybe get some food, and you either go into a restful meditative state for 20, 30 minutes or take a small nap. No, definitely no longer than 90 minutes. And during that time of sleep, those first few stages will help ingrain through the hippocampus and then also to the cortex, which will help ingrain those memories. But if you combine that with the positive and negative feedback, the brain will remember those significantly, so you can pull those up when you need to. So.
And I like that you brought up the positive feedback portion, because you'll find that in high-performing golfers, they choose to stick to what they're best at in the time and truly crucial moments of a hit of a swing or choosing a shot. So let's say it's hole 17 or hole 16 of the last round of golf, and you got 2 holes left, and it's the end of the tournament. You'll find that golfers will stick to the swings they're comfortable with because the ones they've practiced the most, the ones that they know they're more mentally confident with, and it's, you know, maybe they have a different shot in their bag that might get them closer to the hole, or might end up being a bigger risk, bigger reward. But you'll find that some will play the safer, more confident shot because it's something that they have in their bag, they have practiced, and they have the ability to do at that time. And so, you know, you think of these golfers having the ability to hit any club perfectly every time, and that's not the case. There are golfers that are better off the tee. There are golfers that are better with their short game. There are golfers that are better putting. You know, a good example would be you would want to get to a shot where you could get onto the green and be as close to the hole as possible because maybe your putting isn't as good as others. So, you'll find golfers will put themselves in positions or even distances that they're more comfortable with. Say that you really are great at 120 in, but not 150. So you try to hit to that 120 shot so you can put yourself as close to the pin as possible. Or, you know, let's say putting is something that you're more dominant in or better at. So you might take more of a risk on one of your earlier shots to even try to get you close to the green as possible. You might be really far from the pin, but you're confident that you can take and put it either within 1 or 2 putts versus, you know, those who maybe aren't as confident would do it in 3, maybe 4. So again, this is the strategy that a lot of people don't understand when you are a high-performing golfer, and just that thought process, that mental component that people don't understand.
I really like how you brought that up, like playing to your strengths from all aspects.
Yep.
Like that's something I never thought about. That's a really, really good point on that one.
And it's amazing how many you start listening to golfers' interviews and just what they think about. Phil Mickelson, for example, if you've even heard the short 1-minute clip of him explaining, he's one of the best wedge short game players on this planet, and he has memorized which grasses have the least and most amount of resistance. Wow. He has memorized the physics of what water does to grass versus how dry it is, how much yardage it takes off or puts on. Different parts of the day, such as in the morning, it might add an extra few yards, take off because of temperature. It might, I mean, you should really try to look up and see how he talks about his wedges and just how much it can impact yardage. It is amazing to see just the kind of thought processes that these golfers have when they're taking shots. So
That's awesome.
There's definitely more to it if you're just layman's, but the more avid you become, the more you understand of how much this, you know, plays a factor to being the best golfer.
Well, let's go into some of the specifics with Tiger, with Rory, and with some of these other golfers, so we can see if we can have others take a couple 2 cents from what they do so they can implement that into their routine now. As we're going through, obviously, if you're listening to the Bulletproof Golf Series, I'm assuming you've heard of Tiger Woods.
Yeah.
So with his whole injury list, I'll put together a whole screenshot so you're going to see this on the screen here. But Doc, going through all these injuries, man, even a few years ago, we all thought that his golf career was going to be over.
For sure.
And these are incredibly specific injuries, and I know he's changed trainers a couple times, switched up his swing mechanics. Let's go over some of his injuries, and then how does that correlate to what he does on a routine basis?
For sure. So I have about, I believe, what looks to be around 20 or 30 items in this list here of just things that he has sustained over the course of a very long but successful career. I would say the ones that pop out the most often looks to be knee injury, back injury, and ankle injury. And you'll find that once that injury was sustained, there was definitely a repeat part of it. And that just, again, kind of like Doc said right away in the beginning of this podcast, previous injuries are a huge, huge predictor of what might come about in the future. So if you haven't successfully healed and or recovered from them, it's only going to put you at a greater chance of getting that in the future.
And then when you go into any injury, and we've said this before too, you want to rehab in the exact same direction in which you got injured, which unless you have a top-notch trainer which knows that, unless you're training specific tissues, the chance of getting re-injured again and again and again, thus his whole career and why he's changed people up and his swings kind of tells the whole story with that, and any other sport for that matter. But yeah, no, I think that's 2 cents that if you are injured, how did you get injured? And you want to talk to a trainer or physician that can help you in that direction to heal that injury.
Yeah.
But
we might try to bring up some examples in the coming up here. But yeah, a lot of what I have here is, I think he's had 5 back surgeries, he's had 3 or 4 knee surgeries, 3 ankle surgeries. Again, he was in he almost died in this car accident where busted his legs up really bad. So he's been through a lot of injuries throughout his life, but
even mental side, the divorce too, that also
for sure
didn't help at all.
No, goodness no. And being number 1 for as long as he was, there's a good quote that I think always relates, is lonely at the top.
Yep.
And to continue to have that drive to be the best. Again, once you reach a goal, it's, for any of you that have goals set or have tried to overcome a crucial obstacle in life, you'll notice that once it's done, you forget how hard it was to get there, and you become less hungry in a way. I think there's a lot of ways it's been explained is you're less hungry once you've finally got to the top and fed yourself. So the fact that he, again, has been number 1 for so long and has won as many majors as he has, it only goes to show how much effort and fortitude he's put into his entire career. Obviously, the list of injuries has shown that too. And to play through those injuries.
It's crazy.
I can't imagine what that would be like. So what we're going to do is I'm going to take you through Tiger's day-to-day. And this, I don't know how super accurate it is, but this was I think it was Golf Digest, and it really just broke down kind of a day-to-day, pick apart of what he's doing, and maybe Doc can just touch on some of the aspects of how this is going to help each portion of biomechanics of the body, and then of course the actual points of golf too. So he starts with about 40 minutes of stretching. He does core exercises with that. He does an endurance run of 7 miles, speed runs of 3 miles, along with weight training. That's kind of the overview of that. So typically, warm-up morning practice looks like dynamic stretches with mobility exercises. Dynamic just meaning he's moving. And Doc, I even know we've talked about this. Why static stretching versus dynamic? If you just want to quickly touch on that.
Yeah, static stretching is where you're not moving and you're going through and stretching the tissues. Dynamic is, much like Doc said, is you're going through the movement with long lengthening of tissues stretched during movement, which has a better correlation to actually correlate back to any activity, whether it's golf, soccer, baseball. It doesn't matter what sport it is. Dynamic usually works way better. And also, if you're going to longer bouts of static stretching, that will also diminish the threshold of fast twitch type 2 muscle fibers, so it'll diminish the amount at which you can explode through a shot, for this example in golf. So ideally, dynamic is best.
Nice.
And I kind of like what you brought up too, the core exercises. Everything's core to extremity movement, and it's all through a whipping motion of the body as a whole. In terms of the endurance runs for 7 miles, speed runs 3, that's incredibly important, because the more blood flow is going to not only his body but also his brain during the rounds, he can think better. It just takes less effort to hit those shots that can be more stressful. So the lower you get your resting heart rate, the greater that you can build up left ventricular hypertrophy, which is a part of your heart which will help pump blood throughout the rest of the body. The less strokes it takes to go throughout the body, the more blood will also go to the brain, but also to the tissues as well. So he's targeting not only the heart, the vascular system, he's targeting also core to extremity movements. And then even stretching, as long as it's dynamic, maybe a few areas of static, but not spending a whole heck of a lot of time. Ideally, everyone should be dynamic stretching. That's an awesome first part to his training, so
Yep.
I like that there.
Yep. Again, he does some range practice. He focuses on different clubs, again, working from wedge to driver practices, chipping, pitching, bunker shots, anything that you would expect him to do. He does course play, which many trainers have stated they hate range work because they feel the best training is actually on the course with what we've talked about, visualization, actually putting yourself in that shot. Getting to experience it in person is, again, probably only going to make more of a neuroplastic change that you actually are visually, seeing when you are playing.
Absolutely.
Jumping into weightlifting, again, he emphasizes core, back, leg strength. He does a lot of deadlifts, squats, and bench presses. My guess would be to really try to solidify the strength in the erector spinae with the deadlifts. Squats would be the hips because he's going to need to hinge and rotate through those. And then, of course, bench presses just to keep, like you said, proper strength in the chest, pec, those areas as well. Medicine ball throws, resistance band exercises, and bodyweight movements to enhance stability and power. I've seen a lot of those medicine ball throws. Again, it's where you are standing next to the wall and you are very quickly throwing that ball up against the wall and repeating. Again, this is Doc talking about how you need to train in the planes that you are. We've talked about this, I believe, in
100%.
I can't remember which one it was, but even as an Amazon worker who lifts boxes all day, your ability to actually lift up these large boxes and to move them throughout your entire day, it's important to train that way, especially if you're going to be doing it throughout your life. So these exercises are done specifically for that reason, to mimic those exact planes of motions like they are on a golf course and training that way.
And I think my 2 cents on strength training, I think there's certain things that he could do better. So like deadlifts, squats, bench press. Anytime you go into sport-specific training, you want to train, like Doc said and what we just reiterated, is whatever movement you want to optimize, that is the same movement that you want to train in. But if we add in deadlifts, squats, bench press, yes, we're going to be building up those tissues and they will help supply the motor units or how the nervous system connects to the tissues, which will also help. And yes, we want to have a stronger foundation, so more muscle mass so you can explode through and transfer weight, which is really, really important. I think there's certain things that he could do better, like deadlifts. There's different types of movements that can improve the golf swing mechanics and longevity other than deadlifts, and maybe you want to switch up, instead of doing a squat or a deadlift, to ramp up the intensity in which you filter that into the tissues. It might be even better. So for example, if we're going to look to do squats, maybe we'll do weighted squats in an altered stance to where one foot is forward and the other is backwards, and you stack that. So kind of a lunge closer, like a lunge position where your feet are closer, and then you can mimic rotational movements as you're going down into a squat and back up, which will help for the weight transfer. I think that would be incredibly important. But yes, like certain things like this, you don't want to ramp up your 1 rep max for deadlifts. There's a higher chance of injury for lower back disc flares.
Yep.
Squats in a lunging fashion would be fine. Bench press, maybe dumbbells, signal arm with alternating, so you have that rotation aspect of the torso.
Nice.
Instead of working everything in one plane as a whole, which, unless you're an Olympic lifter, you're patternizing movements of any type of Olympic lift training. So like we have to look and see, where are your common tendencies? Do you need to add on muscle? If you do need to add on muscle, these certain things I think will be important. But unless you're at the top of your game, unless you want to maintain the tissue density, there's certain things that I don't know if I would probably not suggest deadlifts for him, especially with a back injury. Like I think, yes, he has to build up those tissues on his lower back, but even going to Supermans or bring your arms and legs up off the table for a period of time and back down, that can build up those tissues just as well with less chance of injury. And similar with bench press as well. So there's my 2 cents on those things. Medicine ball throw is incredibly important. Resistance bands, all that stuff is awesome.
Yeah.
But just nitpicking a couple of those.
Well, I like that you brought that up because I got a couple questions for you.
Please.
So the first one would be, and this is your opinion, so I'm just trying to obviously gain some knowledge on this too. So there are definitely ways of training and building strength in an area without lifting super heavy weights. And it's important to know that because you can sometimes get adverse effects from lifting that weight, such as, like you said, a deadlift, where you don't actually have to go into those heavy movements. You can gain a lot more from a simpler, more focused movement. Is that kind of what you're saying?
Yeah. Like, you don't have to have a bunch of weight to build muscle. Yes, it makes it easier, but risk versus reward. So you can do the same thing as long as you increase the nervous system's intensity to the tissue, and it can be just squeezing the muscle to a full contraction for longer periods of time. Once you send that signal, for whatever it is, the body's going to send resources to rebuild that tissue or to adapt that tissue. So for example, like let's say not even into power, but we want to go into more vascular health, training type 1 muscle fibers, which are the type of muscle fibers that are constantly activated for longer periods of time. You want to go in to adapt those tissues also with your cardiovascular system of arteries, veins, heart. That has to be trained in a specific way, which will send the signal to your body and your tissues to adapt that way. So like I said, for type 1 muscle fibers, you want to do constant work, like level 2, low level endurance, aerobic training, upwards of 45 minutes, a half hour, to where you can have a conversation at the time, but you're still doing that work. That will help on all those sides. But let's say we want to build up tissue. You can do that either by lifting heavy, or you can do that by ramping up the nervous system and funneling that into whatever tissue you want to adapt, if we will. And in terms of intensity, like there's 100% muscle contraction where you can't anymore, and you can do that for as long as you possibly can and ramp off. That will help build up those type of systems to where it's going to force the body to send resources to build up the tissue. So the movement doesn't matter as much as the intensity and focus on what you want to adapt.
Yeah. Which could have saved Tiger in the long run. I mean, again, this knowledge probably hadn't been known within the last 5-10 years
or so.
Yeah. So again, he started in the mid-90s or the early 90s. So a lot of that, who would have known if he had the ability to train appropriately, what could have been done. And then the last question I had was, you talked about multiplanar training. Do you want to just touch why that is so crucial? Probably why not a lot of even professionals are doing that right now.
So the planes of motion there are, and if you want to look at this from a physics standpoint, there is the x-axis, the y-axis, and that's if it was on the ground. And then there's the z-axis, which is, if you look at moving in the z-axis, that's almost like you jumping up and off the ground. So you're moving away from the base or the surface of the earth, if we will. So when we're moving in different planes, whether that's the transverse plane with rotational movement, or we're working in a frontal plane, which is side to side, or a sagittal plane in front or back of us, when we're going through this motion, a majority of golf swings are going to be through a rotational transverse plane. And with golfing, we're not going to be moving into the Z plane where you're moving your body up and down like plyometrics, jumping, even though that will help explode to a certain extent. You can build that into your training, but we want to work on different various portions or parts of the swing, whether it's your driver or your iron swing. You're coming back. And we're going to get to certain people here in a second, to where when they go through the full motion of the whole swing, they're optimizing everything from backswing to the follow through. And what parts can you train? So like when we're going to what Doc said, the medicine ball throws, on how you rotate from one side into the other. I think if you can put any type of specifics even more, so like say, for example, if we want to adapt golfers medicine ball throw, maybe we come up into a backswing phase and then go either straight into the ground or we hold on to it and then we go straight forward. So it depends on what parts of the swing you want to work on, and medicine balls are awesome. If you're going to find a place or a gym, making sure that they have medicine balls and then there are parts where you can throw against a wall.
It's a big one.
Yes.
Yes. And I know you talk so much about how if we trained in more planes, there'd be a lot less injury.
Oh, yes.
Because too often we only are training in one plane. Example would be a bicep curl versus you could maybe, and I don't know, I'm just making this off the spot, but instead of just straight, you could maybe add an angulation to that. Now, same thing would be the back. You could do, instead of extension, you could add a little bit of rotation with it. And too many times, I think, like you have said, we stick to just one plane when we're training.
That's an awesome point, and you're 100% right. So what is your typical swing? And then can you venture off into different angles outside your swing that you might have to go into, especially if you find yourself on a course and you need to hit a shot that your body is maybe not used to, and if it's not used to that, higher risk of injury is going to occur to those tissues.
That's when it's going to happen.
100%.
When you moved in a way that you hadn't moved or trained in.
Yes.
I know that not many people train on turning and lifting a box, and how many times does that cause someone to, that disc to blow out, right?
Yeah.
And so that was awesome. I appreciate that. That's good. Lastly, he ends with yoga or stretching, again, to maintain flexibility of the range of motion. I know that the more flexibility we have with the tissue, the more strength we can get from it. So, and of course, reduce injury when we have more flexibility. He does mindfulness visualization techniques to enhance focus. We obviously touched heavily on why that's super important. And then lastly, he does strategy sessions where he reviews course layouts, plan strategies. Again, this is just more visualization, really.
Yes. So, and this is a part that I want to bring up. Whenever, like, let's say you're competing, or if you're not even competing, what are the other variables? And you brought up with Phil Mickelson on the rain on the grass and how that affects the ball in the morning versus afternoon. It's kind of similar with baseball too. In colder weather versus warmer weather, the ball will get hit farther. I'm sure it's probably similar to
very
golf.
much so. Yeah.
But even where the winds, and even when you're going to practicing on the driving range or just a round of golf, where the winds, where the variables with the wind, and also what's the course layout as well. So you can kind of strategize not only mentally, but also through visualization in your mind.
Yeah, and people don't understand just how much those variables impact your performance.
Oh gosh, there's so much.
And there's a lot to learn about the game of golf too. But what people don't realize is you have a lot more to think about on that course than you may realize. So
Absolutely.
But yeah, that was Tiger. Next up, we're going to talk Rory McIloy. He's number 1 or number 2. He's definitely top 10. He struggled a little bit in the last couple of years, but he's been doing pretty well, I think, this year. But I chose to just really dive into his workout when he chooses to work out. And I know Doc is going to do a great job of kind of picking apart either some of the great aspects of it or things that maybe we could change or do better on. So there's 2 parts to his workout. The first part, he does deadlifts, pull-ups, and a plank, and then he repeats that 3 times. I think that pretty much hits exactly what Tiger did in his too. The second part is lunges, dumbbell plank row, lateral duck walks, a rotation exercise with the medicine ball. He then warms down with some hamstring stretches, hip stretches, and torso stretches. So, Doc, first and foremost, we got deadlifts in there, but new one was planks and pull-ups. Do you feel that this kind of strength training is beneficial, or things that we could change?
There are certain things that he could do better, and I'm sure there's different variations on the trainer who works with him can go into. But and the reason why, going back to some of the basics on why not deadlifts, why not squats, or even pull-ups to a certain extent, I don't mind pull-ups, is where we know with the sliding filament theory and how when the muscles contract and relax, the muscle spindles and the fascicles, they don't always just extend and contract, but they also have a lateral stretch to it to where they permeate outwards. So when we're going, much like Doc said a few minutes ago, when you do a bicep curl, we're not only working the tissues in the straight line, but we're also working a rotational component to those muscle fibers and those fascicles on the inside and outside portion, and to a certain extent some of the tissues on the backside as well. So when we're going to specifics on training, yes, we want to build up the tissue, but also how close to swinging mechanics, how close to rotational work without compromising the structure. That's where you want to go. So like when we're going into pull-ups, yes, we're bringing our body in, and it's involving a huge amount of muscle and neural energy from the brain to the tissues, which will then help adapt tissues. But let's say, can we work that a little bit easier? So when we do pull-ups, can we go from one side and then arc back down to the other? So it can help with the almost like swinging mechanism. Nice. Especially as you're, like, let's say I'm a lefty, but let's say you're a righty. So when we go up to pull-ups, we transition to the right side, and then as we're coming down, we want to arc back down as we're transferring the body. So you can almost transition, even like find a part where you're holding on to a pull-up bar to where you can kind of touch the ground, but your toes are still there. You go up, and as you come down, you're helping transfer weight, but most of the weight against your body is in your upper back, so it'll help transfer all the way over. So there's certain specifics that you want to get into to adapt the specific lines of tension that will mimic whatever sport that you find yourself in.
Beautiful.
Yeah.
That's awesome. That was great. And I think we're using that exact mindset. Take a look at like lunges. Mm-hmm. Instead of just lunges, lunge with a rotation.
Yeah.
Something to that nature. Another one that looks, we have a rotation exercise in there, so obviously he's doing that. Mm-hmm. Lateral duck walk. How would you maybe spice that one up?
Lateral duck walk. I think this will help significantly. I like this one because it's working in different parts of the swing with different movements that you can find yourself into. So when we're going side to side, absorb weight on one side or the other. So I think that's perfect. Yeah, I think it was only a couple of those small things where, like, yes, you can, certain parts of these exercises or stretches will bleed into the goal or maximizing or optimizing your swing. But there's certain small specifics, kind of go back to the pull-up example, that you can add in, which will have a little bit better feedback in terms of time under intensity. Because we know from the previous episode, I think it was episode 2, that in terms of the Hayflick limit, where the tissues can only adapt so many times throughout your life, and once they get to the end of that DNA, to where that tissue cannot necessarily adapt more, but it can maintain. And that's where you have to be very mindful and meaningful with every bout of training, exercise, movement that you find yourself in, which is why I'm pushing more specifics to training, and also making sure that when you're going into training, swinging mechanics, whether it's baseball, golf, to a certain extent, even soccer with momentum arms of the legs, you want to practice both directions. So like, let's say you're righty, not just righty, but you also want to practice lefty. Mahomes does an awesome job. He practices both, not only throwing right hand, but also left, so you don't over-adapt certain lines of tension of the torso, which will also help improve.
I didn't even think about, but that's so true. I mean, if you're going to train heavily on one side, and we'll get to Bryson here in a second when we talk about those imbalances too, but that's going to be a big part of, on the course, you're only hitting one way, so off the course, you've got to strengthen that other side that you might be missing, of course, when you're not training it that way.
Yes.
So I guess my last question would be, this is kind of one that just came to mind because you talked, you got to be so specific with training. You got these guys who are golfing, you know, heavily on that Thursday, Friday, Saturday, Sunday. How often do you think they're training so that they're not either overdoing it? And what do you think that looks like for them?
And I haven't looked into some of the specifics, but if I was going to go and train a person, and this would be any sport for that matter, playoffs, regular season, preseason. Let's say, for example, like what you brought up, a tournament, and they're practicing, you said, what, Thursday, Friday, Saturday, Sunday?
Yeah, they're doing 18 holes Thursday, Friday, Saturday, Sunday on
most tournaments?
I would obviously go through specific warm-ups, warm up the tissues, go into the driving range, kind of same thing that a lot of these majors, Tiger Woods, Rory are doing, but also after the session and also after every shot, down regulation of breathing. So long exhale breathing, get your mind back to center. The sooner you can down regulate that breath to homeostatic levels or your resting heart rate, the better you can expend some of the hormones and chemicals for the rehab process. So especially after each round, you want to go into breath work, long exhale breathing, down regulate the sympathetic nervous system, go into a bout of meditation, just get your mind and body deregulated back from a sympathetic high arousal state back to a calming state. That's going to be important. The other aspect would be after that is taking place later on that night, going through a bout of mobility work, going through long dynamic, light stress on your body of any stretches of the tissues that you worked. You also want to train some of the joints that you've worked as well. So for example, the golf, you need to rely on pretty much every joint throughout the body because of how you transfer weight. So you also want to make sure that blood and brain to body connection for any joint is also on the same page. So I would look to do workspaces where another example would be cars, control reticular rotations as well. And then depending on where you're at in the season, about cardio work as well afterwards. That's more important for other athletic endeavors or sports, but you also want to build up that mental capacity. And maybe when you're going into like a small bout of cardiovascular work or cardio work, if we will, you can mentally go back and visualize certain shots that you went really well or didn't go well, and then maybe have a notebook so you can go back through that as you're doing work. So when you're going and actually doing the exercise, your mentally and focus is there, so it'll also help naturally train the body to bring blood to the brain and also the tissues at the same time, which also puts you in more of a stressful state when you're learning, going back and visualizing, which will also help mimic the stressful times on the course, which have a better coordination.
For sure.
And then probably if you want to build up any of those tissues, ideally if you're going into a weekend of Thursday through Sunday, you don't want to add an excessive amount of workouts or excessive amount of stress on those tissues. So keeping everything fluid, light, mobility works really, really well.
Which is where your thought process of specific training versus overtraining is going to be beneficial if you are in season.
Yes.
Because again, you're already going to be putting a large amount of stress on your body in season. So getting the time where you're not, where you're training, you're not overtraining, and you're sticking to specifics, of course, is going to be crucial. Which I don't know how often people are actually doing that now, but it's going to make a huge difference if you can. If your job is to rotate through your spine, you probably don't want to overdo any training already. Yes, that's what your whole entire game is going to be.
Exactly.
Moving forward, we have one of my favorite topics. It's going to be Bryson DeChambeau. He was a major in physics, and so he took that knowledge to golf, and he has created so many different ways to golf and just the types of things that he's doing on the course. He has a length of a club that's the exact same for each club, which is different. Usually clubs are in different lengths in golf, but he has one single length club for each of his clubs.
So smart.
And he does a certain pattern of swing where he can understand each club at the, let's call right at the start of your swing, 6 o'clock. This would be technically 7, 8, 9, 10, 11, and 12 o'clock. And he's actually mapped out and metriced what that length is going to look like for each club at each clock swing. And most golfers usually measure it in a quarter, half, 3/4, or full swing, not so specific. And he took that and really changed the way that I think a lot of people, he wanted to create it in a way that made it easier for the layman to get introduced, because if you could practice that way, you might more easily catch on to lengths and understanding how and where to hit it that way. But
At that point too, it's almost systematizing the swing. So like if you're a beginning golfer, kind of like you said, definitely go into Bryson's work, because it'll only get you that much further. Because instead of relying on muscle memory for certain shots, it's a systematic format. You can practice each system or each club length, each swing at. I love what you said, not from 6 o'clock, but maybe 10, 11, 12 o'clock. Like, that's so smart.
Yeah.
I had no idea.
It's fun to watch him because he's so analytical, and one of the cool things that I think I remember reading about him was when he wanted to add so much distance to his driver off the tee. So I think, and I'm doing my best rough estimate to remember what he did, but I think he was about 320 off the tee, and I think the average for the PGA is like 280 to 300. So he already was really, really far ahead. But he was able to consistently, I think, bring it anywhere from 360 to 400 off the tee at any time. Now,
Oh my God.
the first part of it was bulking. He added, I think, 30 or 40 pounds on right away because he knew force is equal to mass times acceleration. So he needed to up the mass. Now, when that happened, he mentioned that he got slower because adding all of that weight took his speed off. So it was something that he said he had to sacrifice right away. Now, once that mass was on, he needed to retrain the speed of his tissue. And he did that by literally swinging hundreds and thousands of times, and this is what he quoted, as fast as you possibly can. And he also monitored his swing on a piece of technology that took what his club head speed was and his ball head speed was, his ball speed was, so that he could understand, was he actually swinging faster than the previous one? Because if you're just swinging really fast, you don't really know, did you swing faster than last time? He's very specific. So he was able to raise his club head speed, his ball speed, and he did that every single day, hundreds and thousands of swings, every single day. And once he said he started to hit like 30 or 40 balls in, he knew his speed was going to decrease because he was going to be more tired. So he said he got to push through that barrier, and eventually, just like you had mentioned, muscle memory comes, you start building that endurance up. I don't know if he was doing cardio or not, but it becomes more and more easier to that swing in your bag because you've done it so many times. But what I think the cool thing about all of this is he knew that retraining his swing was going to bring a lot of imbalances to his tissue. So he worked with a muscle activation technique provider, I believe it was Greg Roscoff, and he explained it as a mechanic tuning a car. So Bryson would, have back pain from maybe too much swinging, and he would then consistently analyze what the strength was on this part of the body versus this part, and he continually would activate that tissue during the training so that there wasn't any imbalance. And so the weak muscles were being identified, making sure that he stimulated those to enhance neuromuscular communication. They mentioned that DeChambeau had a left-sided weakness, so he was very dominant on his right side. So that was identified during their training. And throughout the workout, they again targeted specific muscles in training to complete, improve flexibility and strength simultaneously. But I think what most people, would have never thought of during that, which would have been, I'm just going to swing as fast as I can 1,000 times, and I'll be better at the end. But the fact that he just broke that down into detail on, he knew what was going to actually happen once this training started, and he had to make sure that he could keep it as specific and perfect as possible throughout that entire time. I don't think many people would have, had they not had a physics background, would have actually understood and knew that moving forward.
Yeah.
But after that, I think he's got one of the longest drives on the tour, and he can carry like 400 yards off the tee, which I don't think not many people can do. So, Doc, through all of that, I'm sure there's plenty of neuro and biomechanics and anatomy that pops up in your brain. But what's your take on all that?
So I like that. Like when you brought that up the other day when you were talking, I was flabbergasted because that's some things it's not common.
No.
And the more, like I said, more specific you can be with any type of training, the better. So why and how did it improve and increase from 320 to like 400 something? When you're practicing the same rep as hard as you possibly can, and then compounding that with handling the compensations for the opposite side of rotation, you're pretty much increasing the connection between the brain and the motor units of what tissues you are. So like when he goes into the backswing, it's fully, it has a recoil at the top, then comes back down, and the more you can practice that recoil and then going through a full power motion, the better that those motor units from the brain, nervous system to the tissues, the more they're going to attach to specific tissues at specific times. Now what we know through EKGs, when they go into any type of muscle activation throughout anything, a lot of the times it's through, when they do this testing and research, it's via squats or it's knee bends or knee extensions, and what tissues are being activated, what specific muscle, what specific order. We know now that from brain to body, the nervous system fires slightly different each and every time. So the more reps you can practice, and if we know now that each motor unit doesn't fire the same way, so muscle memory is not exactly the same every swing, every step, every movement, but the more variability that you can have, thus the reps, better the body can withstand and have those neural components attached to different tissues, which will then help for the movement all the way through. So when you go into this, anytime you're going to practice and improve any skill, you want to do it to the 100% capacity you possibly can, whether that's mentally or physically. Yeah. So for him, for his drive to improve power and strength, he has to go through maximal strength.
Yeah.
The more he does that, the greater the tissues are going to be laid down for exactly what specific swing that he wants to go through. And as those tissues are being laid down, there's compensations on the other side, thus, for the muscle activation techniques. So, and then you can almost go about this a little different way, and I'm sure it's to a certain extent similar to the muscle activation technique, but if you practice the same thing in one direction, just do the same thing in the complete opposite direction.
Yeah.
I'm sure it's going to be similar. I don't know the in-depth specifics of muscle activation techniques or MAT, but the same premise is true, to where you have to combat the compensations at the same time as you're trying to build up whatever muscle phase technique swing that you want to do.
So away from training, you would have hoped that he was in that gym doing the medicine ball throw in the opposite direction just as many times as he was swinging.
If not even more.
Sure.
If he's going back golfing one direction, you don't want to overdo that same direction, or else the tissues are going to give out and yield due to injury. And then anytime there's an injury, it leaves anatomical change long term, which you have to combat for longer periods of time. So you want to, again, force and build up the opposite side of rotational aspects. So, yeah.
That's awesome.
Yeah.
Yeah, I love that story.
That's so cool.
You should see too some of the videos and pictures. He looked, oh man, when he put that weight on, he put it on very quick. So he ballooned up. Like you didn't even recognize him, because he wasn't very big. So when he really put that extra weight on, it was very interesting. We were all wondering, like, Bryson, what is going on, man? And there was a method to his madness, and people thought, like, what is this guy doing? He was on that range, and I mean, the swing that you would see, you just had never seen that speed before. Like, and everyone was like, how are you going to manage that? Like, that it just looks like inaccurate. Mm-hmm. And again, he got to the speed he wanted to, and then he could control it.
Yes.
Then he started to focus on the aim. Mm-hmm. So starting out, it wasn't necessarily, I'm going to swing as fast as I can and hit it as straight as I can. It was, I need to swing as fast as I can. Mm-hmm. Then once he was able to control that swing every time, he got to dial it in with accuracy, which is not only, the first part was not only impressive, but I'm sure the second part is just as impressive.
And you can even build that up to be even more specific than what he had. So, for example, when I brought up the backswing, how fast can you bring that up? Or the recoil from the top and then back down, or the transfer all the way through, and doing that at high speeds, both directions, of course. But I like how you brought up too, like going back, generate the power, the intensity, have the muscle mass, and then go into specifics on aiming, on control, because then you can filter that into certain slight subtleties of, do you you need to roll your wrist over at this time. It also affects different downwards angles as you're coming through the ball too. So, yeah.
But it just goes to show how many variables are in sports. And I'm sure if you take the example of, for your background, being a collegiate soccer player, there's a difference between kicking a ball really hard, kicking a ball very straight, and then putting them both together. And I'm sure there's a lot of things that come with the training of both of those. So to train power versus speed, there's a lot of differences, and people don't understand that either too.
Angles and time of pace, yeah. And we'll probably get into more specifics with that in a following podcast.
Yeah.
And there's in any sport it's the same way, especially the higher level you get to.
For sure.
That's beautiful.
Perfect. So lastly, we're going to talk on, to end the podcast, a very, very in-depth article that was written by Barbara Brandon, and she took apart the training to prevent golf injury, and it was a really well done review that I liked. And what I liked was she took her knowledge of biomechanics and she broke down each part of the swing and how it would impact each part of the body, which I think is going to be really great, getting Doc's perspective on this too. And then she also took why some injuries would impact the golfer and how it would maybe cause certain compensatory change with each injury. And then moving forward, why each proportion of training is going to be so crucial for the golfer, such as flexibility, strength. We have aerobic endurance at the end, and then we're going to jump into shoes. And that was more of just an addition on my part. So starting off, the biomechanics of the golf swing. So Doc, you're a golfer just like myself, so the first part is just the stance alone. The feet placed shoulders width apart, knees should be slightly bent, which requires dorsiflexion of the ankle, and if you don't have that, I'm sure you're going to have more stress on the lower portion of the limb. You need to be able to bend at the waist, maintain a straight spine, the neck is slightly flexed. Again, there's a variety of gripping styles, but in general, you want it to be lighter due to making sure you don't have overgrip, elbow issues. The lead wrist is in position of ulnar deviation. Stability of the stance can be affected by limited joint range of motion, decreased proprioception, which is common in older golfers. So, Doc, I'm going to throw something at you, and I'm going to see if this would change how either it would make it better and or worse. So, a common setup problem that I see is golfers are either standing too close to that ball or too far away. And so just you want to talk quickly on the biomechanics of the setup that you would understand that to be an issue.
Oh, that's a good point. And going into this, I'm sure there's other people that can break down a golf swing better than I can, but when looking at the biomechanics, wherever you are at, whether you're closer or farther away from the ball that's set up in front of you, will depend on the momentum arm of the backswing and the follow through. So for example, what we were saying, when the ball is further away from your body, more than likely that's going to be a lower club head, so it's going to be a driver, a 3, 5, 6 iron, where you can have more of a full momentum arm coming through the torso and back down.
Yeah. Versus
when the ball is closer to your feet or to your body, you're going to have more of an upwards and downwards swing, which can help for the loft, backspin. So just even that standpoint is going to be important to know. Now let's say we want to place the ball either off of the front foot or the back foot. That will also change the variability. So for the front foot, that's usually where I line up for specifically my driver or my drive.
Yep.
It allows you to go through more full of a swing, and then as you get through the full downwards angle upon contact, it's also going to allow for more power behind the swing, especially core to extremity, versus if you're going to be off your back foot, you're going to be able to get more spin on it because you're coming downwards at a choppy angle. Now, depending on sand versus rough versus fairway, that's where you have to practice that on a driving range. But just even those specifics, going back to the gentleman we talked about too, and how he fully practiced swing, not only from 6 o'clock but 9, 11, 12, and practicing from there, and then back down the swing, follow through. It depends on what shot you want to take. Do you want to go for a hook, a draw, or the other variables in play? But that's kind of the specifics that I would look at. Is there anything I missed?
That was perfect. That was awesome. Yeah, that was great. And usually, the one things that I pick out too with golfers is if they are standing too straight or if they're too bent, that's going to change how that rotation impacts the body. Other things is they don't have their knees aren't bent, they're more again straight up. That's going to cause again more upper rotation, where if you have the bending of the knees, you're going to get more hip rotation. And too many times even like the patient we were talking about, when we don't have good rotation at the waist, it's going to put more strain on the upper body or other areas, and you're going to have a bad time. So that was perfect. This next one I think is going to be good because it's going to talk a lot about a lot of the things that we see in the clinic, including just set joints, functions of the spine, and so forth. So the backswing is the takeaway. So obviously you have to emphasize the flexibility to load the kind of the muscular springs that you would talk about the recoil. So make sure that you can store that power for when you are moving through to the downswing. So during this portion, it puts strain on the lumbar facets, the L5-S1 area, and the SI joints. The intervertebral discs must be able to also withstand that increased pressure, such as the annulus fibers. The trailing arm is abducted and externally rotated, while the elbow flexes. The leading arm is internally rotated and abducted across the chest as you're coming up, loading the AC. Transfer of weight towards the trailing leg increases force. So if you're coming off, if you're a righty, as you bring that swing back, it's going to put weight onto the knee. And similarly, pain from pre-existing conditions such as arthritis of the knee or the AC joint may limit performance upon that. But all known that the cause of injury is altering normal biomechanics to accommodate for some limitation of flexibility, strength, or range of motion. So I think the only thing, or a couple things that we could talk on there, would be how someone who has a low back issue could either have issues with that portion of it, would be the low back or the AC joint, or something that I picked up. But anything that came to your mind when I was reading through that?
No, that was good. I think if you don't have the flexibility to bring the club all the way back, especially to 12 o'clock, or when your club heads are right above your head, it's going to limit the amount of force that you want to have to absorb through the ball, and force compensations to the momentum arms of your lead foot or your lead arm and or torso lower back. So when we're looking at building on the backswing, a lot of this will be going into positional holds, mobility of going back all the way up as you're holding your base of your torso legs in a neutral stance. And then maybe spending some time with rotational movement when your momentum arm is backwards.
Multiplanar. Nice.
100%.
Yeah.
And then I think a huge portion for the backswing is also the latissimus dorsi, which goes from the upper arm down to the lower back, and that can be incredibly contracted or tight and tense, which often controls internal rotation of the arm as well. That's also going to limit the amount of power coming through the backswing, and then it'll lead to compensations specifically to the lower back. So if you have problems with the backswing, or if you can't bring your club head backwards, work at mobility with the club, ideally, or practicing if you have the club in your hand with a dally stick, PVC pipe, and then you can work on the transfer of weight down and just work on bringing the backswing up, and then try to get that ingrained in terms of your muscle memory from driver, 1, 2, 3 iron, if the ball was ahead of you, and then what does that momentum arm look like coming backwards versus the higher clubs of 9 stand pitching wedge, to where you're going to come almost straight down, and those different angles will matter as you come back through. Fall through.
I love that. That's so true. And I like that you brought up the mobility portion of it, because again, I've always had left shoulder issues, which has put more strain on my right shoulder on my backswing. So they talked about the AC joint, which is absolutely, when I keep my my lead arm as straight as I can, I almost have a little bit of a resistance towards that portion of my backswing. So I have to compensate more of my backswing with my trailing arm. So it almost has caused me to jam my shoulder back to get more backswing, versus if I had more range of motion in this lead, I could get more with the lead shoulder. So it obviously makes a huge difference as she explained that, and it makes a lot of sense to me because I've obviously dealt with that. So
Yeah.
now coming into the downswing, a lot of explosive power is going to be needed, again, as we shift all of our weight through the club. So flexibility is still important, but this is, I think, where you can maybe talk on just the explosive power and how that needs to be built as you move through. You talked a little bit about the uncoiling now as you've coiled. It's got to move through the hip extensors and abductors and improve the rotation of the pelvis. Further acceleration for upper body is provided by contraction of the transverse abdominis and oblique muscles, while the erector spinae has to stabilize the core as you put that much force through the spinal column too. So pressure in the discs are relieved, but a reverse stress is applied to the SI joints and facets. The leading shoulder is then abducted. During this phase, the leading forearm extensors pull the wrist into slight dorsal flexion. The magnitude of force is obviously greater if the club head strikes the ground rather than the ball itself, which if we ever ducked a shot, we know what that feels like. So I think the cool things, or the things that came to my mind, were why it's important for the erector spinae to stabilize that column as we go through that explosive force, why those abdominals and those obliques are going to be important, but then anything else that you picked up with that as well.
No, that's good. If you're going to train the downward swing and the follow through, all of it is going to be through the transfer of weight from one side to the other. So how well this will go back into the medicine ball throws. Do we want to start off mid swing all the way up and then just transfer the medicine ball release down to the ground, especially for your irons that way you want to chip, or let's say we want to go through when the ball's farther along with your driver 3-1 iron. You have to bring the ball back at a different angle and then throw it at that exact angle and try to have the ball touch down where the ball would be or slightly in front of where the ball is as you're transferring through, which will also help the momentum as you come through. Now, I think it's something really, really important that most golfers don't train on, to where when they go through the follow through, practicing not only the upwards backswing and then follow through, but also when you're at where the ball would be make contact, and then practicing on the follow through as your arms are coming through, because those tissues you have to be able to generate and then transfer weight, but also then to absorb the force on the opposite side. So the more you can absorb that through, like let's say on a front arm, for example, being a righty, holding a band so it's contracted, and then you're allowing your body to absorb force back in to the same direction where the band would want to go, or the band's on the opposite side, you're holding it there, you're trying to generate power, very light, intense band as you're coming through for the driver or for the irons, and then hold that there so you can help for the transfer and absorbing the weight all the way through for less injury on not only the front lead, shoulder, elbow, or wrist.
And that's the validity and flexibility as well. Again, once that motion's started, you got to be able to stop it.
Yes.
And just as important as creating force is stopping it without putting it somewhere that, again, might compensate if you continue to put that force somewhere to stop it that we don't want it. So.
Same thing with pitchers, follow through, especially curveballs.
Lastly, we have the follow through. So perfect, actually, because we just kind of just ended on that. So the final phase, this is where the ball is now hit and we are coming through. Like Doc was just talking about how we need to now be able to contain that force that we just created. Suffice to say that throughout the swing cycle, wrist motion is complex and obviously serves as a possible source of injury. So now that we've come to neutral, bringing the wrists, obviously if you've golfed, you know that there is a portion of rotation that needs to happen as you are coming through the swing. So making sure that you are doing that rotation. If you aren't, it's only going to put more, I would call it, if you aren't rolling your wrists, it's a lot of just that hard deviation as you come all the way through, which might maybe jam those wrists too if you aren't doing that.
And just to touch on that point,
Yeah, absolutely.
Doc, I love your take on the amount of intensity you have on the grip.
Sure.
Because I think this would be a perfect segment. So if you start noticing that your shot is slicing or hooking, a lot of that will come from either over rotation of the wrist or lack thereof, which if you have a tight, tense grip or a light grip, that'll also change. So I guess what's your take on that when you're talking to people?
For sure.
The intensity.
For sure. And so another portion of grip can actually be the angle at which you grip. So there is a type of grip called a dominant or strong grip, where you actually bring more of your backhand under, which allows for a lot more force. Now, one thing that it causes you to do is over grip because you're trying to swing harder. Now, that force has got to go somewhere, and if you don't properly distribute that through the swing, it's going to have an impact, whether that be the wrists, the elbows, the shoulders. So most, and again, you have three different types of grips. You have the 10-finger grip, baseball grip.
Okay.
You have usually the pinky over the finger grip, or you have the interlock. And a lot of golfers like the interlock because it actually can take force off of the club, because it requires you. It's almost a tricky. What it allows is, first, there's very little rotation between your hands as you grip, so you have the ability to keep that grip where it needs to be, versus as a 10-finger hold, your ability to do this now is increased. So the interlock is where that's going to be more helpful. Now, it's kind of a funny feeling when you grip it this way first, but what it can actually do is reduce that grip strength and keep it more neutral or stable of a grip. So those of you that are doing a 10-finger grip, maybe you're a baseball player or a hockey player, that's a common starter grip for people. Is because it's what they used to maybe doing first, whether they were baseball or hockey. So there are some golfers that still do a 10-finger grip, but most golfers do the interlock and or the pinky over the finger. So why, one, it can rotation, and two, it has the ability to take grip force out of the grip. So. And if you do end up doing a 10-finger grip, just make sure that you glove that you're replacing often, because you're going to put a lot of force through it, and you're probably going to go through it quickly. And you might eventually get to a point where that club is going to slip, because, again, it's easier to do that when you don't have an interlock. So just things to think about there.
Good.
Yeah, towards the end of that swing, abdominal muscles will begin to eccentrically contract to slow the rotation of the trunk. The facets and the SIs now have to absorb that stress at the end range. Pressure is going to be put on the disc again. The annulus will be torqued in the opposite direction. The AC joint will try to slow the momentum of the rotating trunk, and the weight is transferred to the lead knee. So things might go awry during this follow through. Would definitely be not being able to rotate around that knee now that you're following through. If you don't have good rotation through the trunk, you might have issues there. Anything else that you could pick up, Doc?
No, that was good. I think there's a part to where probably should have brought this up a little bit ago. In terms of the feet stance, the wider your base, the farther apart your feet are, the tougher it is on, especially the knee joints and the lower back, to where it's going to affect the transfer of weight from one side to the other. So the closer you are ideally you want to be probably shoulder width, if not a little bit wider, so it helps with full body transfer of weight from one side to the other with less pressure on knees, lower back.
Oh, that's great. I'm glad you brought that up too. The knees are tough for people. That's the one that we see a lot of that can limit golfer from continuing is knee and back for sure.
Yes.
So yeah, that is the biomechanic breakdown. Next up, thought this was just interesting. Women are more likely to get forearm injuries at the elbow compared to men. Men are more likely to get wrist injuries compared to women. And then among amateur male golfers, back pain accounts for 36% of injuries, while only 12% in women. Young players tend to get new injuries, olders tend to make existing conditions worse, which I think is interesting. It might be due to a certain amount of variabilities, but for me, it probably is due to men gripping harder, swinging harder, due to the wrist and the back. It would be my guess, but
And probably momentum arm too.
Sure.
Transfer weight. The larger the shoulders are at, the more acute that. I kind of think of it as like acute angle for women, where the wider the hips, the more the knees come inwards, and the higher chance of knee injuries. Kind of similar with the wider the shoulders are at, where the momentum arm's coming through, and how it's going through the wrist. Versus women have a tendency to have deviation outwards of their elbows,
okay.
which then would make sense for
why they have more forearm injuries then.
Yeah.
Oh, that's super interesting. Got it. Good point. Very
generalization,
good point.
kind of.
So let's move into training tools. I think that'd be a great way to hit here.
Cool.
I think where I wanted to hit, we have flexibility, we have strength, and aerobic. So flexibility, from what I remember reading, they had talked about a daily program of at least 6 weeks to start. Then before each round 2, like you had said, concentrate on relaxing the regions being stretched, hold positions. This is more static stretch. This is a little bit older. I'm sure there are better ways to do that. Hold for 30 seconds, bring them down. So I already know that this is going to be an outdated, more form of trying to improve flexibility. So I don't think we even need to go into it. I think if we're going to touch on flexibility, Doc, what are 2 or 3 big ways to actually get the most out of flexibility training?
Let's say someone is out of season. They have anywhere, let's say 8 weeks, 12 weeks to where they can train, either grow muscle or gain flexibility. First off, you want to go hitting. You need proper nutrition diets where you need a proper amount of protein intake. That's going to be one. The other aspect is going to be, if you want to build up tissues, you have to see what tissues are specifically being performed at, especially rotational tissues. So core to extremity movement, build up the intensity of those sessions in a periodization fashion. So when I say periodization, it's a scheduled ramping up or de-ramping of whatever exercises you want to do, depending on what goal or sport you have. So, for example, certain gymnastics training movements are going to be much different than football. It's different tissues. There's either more flexibility and fluid motion versus strength, power. So, for example, for golf, we need a mixture of building on that weight and then utilizing that weight into mobility fashion. So I'd look to build up tissues there. If you want to increase flexibility, you want to go into fascial plasticity holds. So going into positional holds, especially backswing, applying a light muscle contraction, anywhere from 25% intensity to 55 or 50% intensity in those lengthened states, with a minimum of holding of 2 minutes total a day. Anywhere from 2 to 31 minutes is where a few lines of research is at there. And then add in that training with functionally using your golf swing. So when we look at training athletes, we want to ramp up the nervous system, connect the nervous system to the motor units or those tissues, and then add in a functional component to that. So for the golf swing, that would be going through a full light swing of, let's say, a driver or iron. And then you want to ramp that up anywhere from 3 to 6 bouts or reps after an intense bout of exercise, whether that's plyometric work and then going to a swing, or a high bout of either dumbbell rows or pull-ups, single arm, kind of like going back to that, and then add into the transfer swing. Ideally in the training, both sides, kind of like what you said as well. But anytime you're training an athlete, you got to build up the tissues. You then want to add in a functional component, and depending on where they're at in terms of building up the power, strength, hypertrophy, there has to be about a 1 week deloading, off-ramping, so you can build up, off-ramp, build up, off-ramp. Because if you continually go building up these tissues, oftentimes there's injuries that occur from there.
For sure.
So you have to make sure you have someone that can periodize your training schedule quite
cycle
well.
in a way.
Yes.
In a way. Yeah.
Yep.
So for sure, you're going to want to warm up before you try to improve flexibility. But then once that flexibility is gained, that's more likely where you could start adding to the strength portion of things too.
Yes.
Yeah. But if you only are strength or hypertrophy training, there's going to be a good chance that you're going to be overusing and or chance of injury.
Yes.
Yeah, for sure.
Yeah.
Awesome.
Now, Doc, I'm so curious because when you brought this up, especially with the shoes, from the cleats or the bottom portion, how was that trend, especially for decreased risk of injury? And is there anything aerobic endurance wise you want to touch on? Because I know there was that small.
So I know aerobic is, like we talked about with Tiger, he absolutely ran 7 to 10 miles a day. I mean, that was a huge portion of his training. Golfers approximately walk 3 miles playing 18 holes, so you're going to need to, that needs to be like breathing to you. Like 3 miles walk is like, that doesn't affect you at all. So making sure that you have the ability to do that consistently. Now again, if you're in the cart, it's different, but for someone who is, professionally, you don't get the cart. So that's just really what I wanted to touch on there. But if you are going to be walking all of those holes, that's where I wanted to add this last part in. So breaking down different types of golf shoes. Now there are shoes that have spikes on the bottom, but they're usually more rigid. There you can do a shoe called a spikeless, where it looks a lot more like a regular training shoe. They just have ridges on the bottom, which can help with getting traction. So with the spike shoes, you're going to have better traction because they actually have things that drive them into the grass. But it concentrates certain pressure points under the feet, which again, if you're doing that routinely, it might cause discomfort or fatigue on the certain areas that the spikes are on the bottom of the shoe. But again, they're very rigid, so walking those 3 miles on those rigid shoes are going to alter your gait, which again, we've talked about gait cycle, how that's going to be an issue. Increase of possible biomechanical imbalances doing that. So the spikeless shoe has been something that a lot of golfers are switching to because it allows for that more natural foot movement when you're walking all of those, and it reduces the risk of having pressure points, discomfort on the parts that have spikes. And even though you're giving up traction, it's still offering enough grip to at least get performance, but you're not giving up, changes in structure walking all of those holes, and it might minimize, fatigue elsewhere up the chain. So for me, I think switching to a spikeless shoe is something that's going to be way more popular in the next how many years, and I think most are even starting to do that now. So
I like that too.
Yeah.
It would only make sense if you are going spikeless if you are like a pro that you're constantly walking however many miles, versus someone that rides in a cart is more recreational, then you could probably get by. But yeah, from a biomechanics standpoint, with the grip of longer spiked shoes, it'll help for the transfer of weight much easier versus less. There's a little lack of efficiency, but risk versus reward. If you're playing pro, especially going in a tournament Thursday through Sunday, I would for sure want to go spikeless.
yes, for long-term thought processes too, right?
100%.
Legitimately bulletproofing you long-term. If you're going to do this professionally, I think that's the choice.
That's beautiful. I like that point. That's really good.
For sure.
Yeah, if you guys have any questions, comments, stuff that you want us to dive into a little bit more in depth, by all means, please, we'd love to. There's certain things that we may or may not know that we haven't touched on today, but we're here to help out as many people as possible. So,
Yes,
yeah.
absolutely, guys. Thanks so much for watching. That was Bulletproofing the Golfer. Look forward to our next series on the Bulletproof the Athlete. Doc,
Woo!
have a nice day.
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, Your journey to a healthier you begins with understanding the functional code. Until next time, stay well, stay informed, and embrace the science of living well.